Hi, my name is Victoria Barr from FTI Consulting, and I'm an economist, and I spent 2 years working on secondment at Monitor, as was at the time, in the UK, working on our price regulation system there. So today I'm going to talk a little bit about how we set prices for hospital services in the UK, and I'm going to talk a little bit about the evolution of pricing from a system where we reimbursed hospitals with global budgets, so a fixed annual sum. And then we moved in the 2000s to a sort of fee for episode model where, or DRG-based pricing, where hospitals are reimbursed for each patient episode. And I'm going to explain a little bit how we set those prices by collecting cost data from every single NHS provider in the country, and then basically calculating an average of those costs. Now there are various other adjustments made then to the prices to account for things like inflation and expected efficiency, which is quite a controversial element of the pricing model. And then I'm just going to discuss some of the issues with that method of pricing. In particular, in the UK, we have quite a lot of data quality issues, which lead to prices which are not always very cost reflective, and some of the issues that creates in terms of volatility of prices between years, and potentially quite a bit of cross-subsidisation between services. And then essentially I'm just going to conclude by saying that DRG-based pricing is difficult to get right. You need to throw quite a lot of resources at it to get those prices correct. And even if you were able to get the prices right, then it's not a panacea. I think that's my warning really, that firstly, DRG-based pricing is not really appropriate for all hospital services. So it works quite well for quite standardised, discrete types of care for patients who are otherwise healthy, so for example hip and knee replacements or cataract surgery, and not so well for services where there is a capacity element or a large element of fixed costs. It's not really appropriate to reimburse that type of care on a volume model. And then I'm also going to sort of talk about the challenge that we face going forward in terms of managing care across the system for patients with long-term conditions, and reimbursing hospitals on an activity basis is actually not necessarily what you'd really want to be doing to create the right financial incentives across the system to invest in prevention and to integrate care across the patient pathway.